What are the health and safety risks and consequences of unaddressed OT workplace psychological health problems? According to the National Standard of Canada for Psychological Health and Safety in the Workplace, 500,000 Canadians in any given week are unable to work due to mental health problems, and 1 in 3 workplace disability claims are related to mental illnesses. Unaddressed workplace factors that affect psychological health of employees can increase the chances of employees developing mental distress and even mental health disorders. These conditions may range from mild to severe, but can have an impact on everyone involved, including the OT, the employer, clients, and coworkers. Here's a visual to help you determine the effects of psychological health conditions on all of the key stakeholders. As you can see, those key stakeholders are the OT, coworkers, employers, and the clients. All of these are within the environment of the workplace. This diagram will come up again when I introduce a brief case study later on in the presentation. How do these affect the OT? Well, workplace factors can increase stress, which can develop into mental health disorder. OTs may begin to feel strained, threatened, demoralized, and disengaged from their work. OTs may begin to feel depersonalization with their clients and their workplace, which can result in a loss of empathy. These effects, in combination with their personal factors that may influence their mental health, can cause OTs to make poor decisions, provide poor treatment, and fall behind on their workload. This can increase the chances of injury or accidents occurring. Coworkers are affected because they often develop close relationships and teams. However, when a team member becomes ill, the side effects can result in a lack of accountability, social isolation, and strains on the relationship between coworkers. There is a risk of horizontal violence between coworkers, or in other words, when coworkers discriminate against other coworkers because they have a mental health disorder. There are many impacts on the employer for unaddressed psychological health problems with their employees. For example, they may lose a lot of skilled employees. There may be legal repercussions for failing to recognize psychological health concerns. There may be an increased cost associated with the higher usage of benefits, lost productivity, insurance costs, and recruitment of new employees. The impact on the employer's reputation as a service provider may also occur. How can psychological health concerns impact clients? Employees' psychological health can impact the overall quality of care that clients receive. It can also impact their physical and psychological safety as well. Not only can it impact individual clients the OT has direct contact with, but it can also impact future clients, as poor quality of care and safety records may begin to create a reputation that's negative for the employee's organization. So here's a brief case study that will help give an example to provide information about the effects and risks of unaddressed psychological health problems in the workplace. So Anne, Jane, and Chris are 3 OTs who work in a very busy hospital. Anne has recently been feeling anxious and depressed since her divorce. At work, she is feeling overwhelmed and underappreciated. She's beginning to fall behind on some of her work and often misses appointments with clients. Jane, a good friend of Anne's, knows about Anne's current troubles and has been trying to pick up some of the workload for her. She has been helping Anne for the past 2 weeks and is beginning to feel fatigued herself. Chris has noticed that Anne has been coming into work late nearly every day and sees her taking breaks quite often. He decides that he deserves more breaks during the day too. This is starting to impact his ability to get through his own caseload. Now let's use this visual to help us organize the information we are given in the case study. This will help us identify the risks and consequences of Anne's unaddressed psychological health problems in the workplace and how these impact each of the key stakeholders. For Anne, her troubles in her home life are starting to spill over into her work life. She's feeling overwhelmed and overworked and isn't getting any help from her employer, nor is she trying to seek professional help because she feels embarrassed. She's relying heavily on Jane to help her. Anne may be at risk for developing a chronic mental health condition, which could cause her to have to take time off work. She may also be starting to make poor work decisions due to her distractibility. It's impacting her coworkers because Jane has been helping Anne as best she could, but is now starting to feel the repercussions of it herself. She may be starting to trim down her own time with her clients to help accommodate Anne's clients. She may be missing breaks or working through lunch in order to help. Jane is starting to feel overwhelmed. This constant pressure could result in fatigue, which may make her more susceptible to sickness and even mental health conditions such as stress, depression, and anxiety. Chris is also starting to notice Anne's work habits and showing up late to work and taking many breaks. Chris feels that he is entitled to do this as well. shows that Anne's unaddressed psychological health conditions is starting to breed a workplace culture that is not productive, it lacks in team morale, and can lead to the isolation of Anne. It's impacting her employer because they are at risk of losing Anne and possibly Jane. They may need to take time off work in order to address their psychological health conditions. Also, because these employees are cutting time with their clients, this may be impacting the employer's reputation as a care provider. This could have long-term effects on the employer. It's impacting the clients because Anne's psychological health conditions may be impacting her ability to make decisions, and she may be more distracted during her time with her clients. This may also be true as far as Jane goes. She may be feeling distracted and be making poor decisions as well. This may cause her OTs to make quick decisions without considering consequences, perhaps disregarding safety protocols set in place because they take too much time, or they may be missing important information about their clients during their case reviews. This will impact the overall quality of care given to the clients. The degree of impact of these unaddressed psychological health conditions on the key stakeholders is also dependent on the workplace environment. For example, if this case study was to be occurring in a burn trauma unit in the hospital, then the impact on the OT and the client could be very serious. Because of the nature of the work in a burn trauma unit, the psychological condition of Anne could worsen very quickly. And if poor decisions were made because of this psychological condition, then the repercussions for the client could potentially be life-threatening. So in summary, psychological health and safety is as important as the physical health and safety of employees. It impacts many stakeholders within the workplace and should never go unaddressed.